Why does COPD chronic cough cause hoarseness? Imagine coughing so much that your voice starts to sound rough or strained. That's often what happens with people who have chronic obstructive pulmonary disease. When someone has COPD, their persistent cough can actually change how their voice sounds. Let's find out why that happens. Chronic cough in COPD is not just a simple tickle in the throat. It's a forceful, repeated action that can irritate the vocal cords, which are tiny, delicate folds inside your voice box or larynx. These cords vibrate when you speak or sing, helping produce sound. But when you cough a lot, especially forcefully, it puts a lot of stress on these cords. This repeated trauma causes inflammation and swelling, which is called laryngitis. When the vocal cords become inflamed, they don't vibrate normally anymore. Instead, they may vibrate unevenly or become less flexible. This change makes your voice sound hoarse, rough, or strained. It's similar to how a sore throat makes your voice sound different. The more you cough, the more irritated your vocal cords become, leading to longer-lasting hoarseness. In COPD, the airways are inflamed and produce extra mucus. This makes coughing more frequent and intense, which adds to the strain on the vocal cords. Also, COPD can cause increased sensitivity in the nerves inside the larynx, making the cough reflex stronger. This means even a small irritation can trigger a big cough, further hurting the voice box. Other factors also play a part. For example, many people with COPD are exposed to cigarette smoke or pollution, which can inflame the vocal cords. Some may also have gastroesophageal reflux disease, where stomach acid flows back into the throat and irritates the vocal cords. All these elements combine to make hoarseness worse. Managing this hoarseness involves controlling the cough and reducing irritation. This can mean treating the airway inflammation, avoiding smoke and pollutants, and managing reflux symptoms. Resting the voice when possible can also help. Sometimes, speech therapy can teach techniques to relax the laryngeal muscles and improve voice quality. So, the main reason COPD-related chronic cough causes hoarseness is because the repeated, forceful coughing inflames and injures the vocal cords. This disruption in their normal function makes your voice sound rough or strained. Additional factors like airway inflammation, nerve sensitivity, and irritants make the problem even more noticeable. Understanding this connection can help you better manage symptoms and protect your voice.